All right, so the final part of talking about biceps tendinopathy is focused on the exit criteria or some things that we're really focusing on achieving in later stage rehab. I think we probably both can agree that with regards to our two separate subsets, right? You have your active adult that maybe has less sport specificity in terms of the demands being placed on their body, and then the athlete itself, there's different things going on. But once again, the big things that we are focusing on is rate of force development necessary for some of these activities. Earlier we talked about pressing and flying movement, flying specific movements with regards to eccentrics, more tempo-based activity, but now's the time where we're focusing a lot more on what we might quote unquote call plyometric activities, right? There's more of an introduction of that elastic component, and that biceps tendon has a lot more demand with regards to how quickly it is going through that stretch shortening cycle. So with that picture being painted for the group, where are you focusing on in particular with a biceps tendinopathy in the later stages?
Absolutely, and with this, I think the easiest way to do is reverse engineer to remember how we got here. To preface plyometric activity, we need to have requisite strength. To do strength activities, we need to have requisite mobility. And to have mobility, we need to have the ability to tolerate that. So to get to this point, we have symptoms under control, we've established range of motion, they're no longer provocative in those end range positions, they've gone through an extensive strength training program, so now we're into plyometrics, and our plyometrics really piggyback off of the strength movements that we did. So if we're doing upper extremity plyos, med ball work is, I think, the easiest entry point, especially in our clinical setup with what we have available. And when we look at the medicine ball throws, there's a variety of different ways that we can go through them. And the two that come to mind that are most relevant to the bicep are either going to be more of your pressing and throwing variations, whether it's a two-handed chest pass or maybe we're offsetting to one side and we're still going through that chest pass or shot put type motion, but we're having one arm being the predominant mover. And the other variation being more of our scoop throws, where we have more of a underhand grip going behind the body and releasing that way. And they would really mimic more of like a dumbbell press with your chest press type throws, or more of your fly motion with more of your scoop throws. So with these, the things that we're really looking at, are they able to tolerate that quick stretch mechanism? And are they able to tolerate that high velocity that you're attempting to perform the activity at? So with this type work, I tend to care less about the weight of the med ball at an entry point and more about their ability to move it quickly, because that's the whole point of why we're doing it. And then once you find that they're able to do the pressing and the scooping type throws, can we do those from a shared environment of a bilateral position? Can we offset them to one arm? And then can we progressively go faster, heavier, and overall volume increases from there?
Yeah, and I think if I take that and then break it into two separate categories in terms of very easy ways to manage the introduction of medicine balls, the first part is compete versus complete. And I think we both can agree when you start to introduce plyometrics, you're not telling anybody to have anything close to a max effort, right? It could just be, hey, I want you to do more of this long lever scoop toss, just to kind of introduce tolerance, lower intensity, a little bit more higher reps, and then we build, much like our cardiovascular reconditioning process. Eventually we get to a point where that scoop toss is high intensity, it is that max effort toss, and we're doing significantly less reps. And then with regards to manipulating the different components of how we get into a position, whether or not we're using stretch shortening cycle or not, I think of, if I draw a parallel to like counter movement jumps, like, okay, let's get into the position where we're loaded and then press out, or let's get into the position and then throw, versus what we want to eventually get to where the ball's out in front of our body. We go through that full eccentric loading, stretch shortening cycle, and then we're exploding out. So I don't know if you have anything in terms of recommendations of kind of how you would focus on things during each of those two separate categories, but that's something automatically that comes to mind with me with regards to medicine balls, you know, compete versus complete. And then either having stretch shortening cycle or not having stretch shortening cycle as we introduce, you know, more elastic demands.
That's a great way to describe it when you make the comparison to a counter movement versus a non-counter movement jump with relation to lower extremity to upper extremity plyometrics. And a common strategy that I'll find myself doing is, one, like you said, just tell them to go through the motion at a submaximal effort. I'll tend to position them closer to the wall at which they're throwing, so it's less effort to get them to the wall. It's also self-limiting because if they throw it too hard, it's just going to ricochet back off and hit them. So they're only going to throw the ball so hard. And then I will tend to put them in a loaded position or put them in that already kind of cocked position of throwing. So you're removing that initial stretch from it. They're in a stationary position, and then just having them release the ball from there. Show me that you can get into the position and tolerate it. Now show me that you can get force generated from that position. The lower extremity equivalent of that would be like asking somebody to sit on a plyo box and jump from that position, or to start in a squatted position and jump from that position. With that, the benefits of it is you're reducing the coordination efforts and a lot of just the motor control and neuromuscular means that have to take place to carry out the motion. And it allows you to tease in really their ability to tolerate position and produce force. If they do well with that, perfect. Now let's start them from a neutral position, load into it. From here, you could have them pause. Show me you can get there, pause, then release. Then you could go into just your traditional motion of loading and unloading, and then you just make it more intentional from there.
And I'm going to close just by talking about two other very, very specific population subtypes. One is going to be the potentially CrossFit athlete that is doing jerks. And then the other one is going to be the throwing athlete. If we use the same principles that we just discussed here, there's a very, very big difference between me having a barbell or dumbbells overhead, bringing this down, going into an immediate press back up, or me catching the weight from that upper body position, pausing, and then maybe doing a little bit of a jerk overhead. So depending on what that looks like, and I know in CrossFit there's sometimes a more cyclical way of doing it as opposed to how we may do it in a competition, but considerations for how you're manipulating the loading of that movement and then the actual force production part of that movement and what the stretch shortening cycle demands are. And then with regards to actual throwing athletes, right, there's a difference between me here coming back into my layback position and automatically going into a throw versus me getting here, freeze frame, and then throwing. So if you are introducing some of those later stage movements in the clinic, just make sure that you are considering that in particular, manipulating the stretch shortening cycle, putting them in a situation where there's less demand, and then getting it eventually back to how it normally would be outside of the office.